to think that way. The second suggestion, plan home-based activities. Now, this is what I'd like to call distraction technique. Distraction technique. Activities around the house, such as baking, such as reading, such as games together. If you are within the family, you are not isolated, games together. Even where you are isolated, if you have access to games, you can, if you have access to digital devices like a laptop or an iPad or a smartphone, you can play games with the computer. It engages the mind. You can even organize brainstorming activity around you or virtually if you are isolated or in lockdown. Call your people or your friends, family, engage them, talk with them. Let there be an activity that occupies your time. Anything to task the brain and to task your hands are helpful in this situation. Activities such as these would or should reduce the feeling of loneliness, the feeling of isolation. Number 3, keep a record of your worries into 2 basic categories. I'll say that again. Keep a record of your worries into 2 basic categories. First categories, things you have control over. The things you have control over. Second category, the things you have no control over. The second category, the things you have no control over. And let me explain how this works. For the things you have control over, try to rationalize their impact on your situation. Things like choosing to believe the best and not the worst is within your control. You can choose to be optimistic rather than pessimistic. You have control over that. You can choose to exercise your mind, to exercise your brain, and not just sit down like a couch potato. You have control over them. These are things within your control. So your worries, the things that worry you, I'm going to get obese in this lockdown. You have control over that. To control what goes into your body and to control your ability, your power to exercise your body. We had discussed this in the previous video. Please check under for this video. You will see it there. These are things that are within your control. For things like the rapid way the disease is spreading, looking at the COVID template every night, every morning, you really have no control over this. So you can deal with it in my next suggestion, in my next tip. So these things that are not within your control, you put in that list of things not within your control. So the fourth suggestion that should deal with things you can't control that I mentioned earlier, control what you consume. Control what you consume. Stop watching live TV or listening to radio where the discussion of COVID-19 pandemic is on rewind dial 24/7. Since the lockdown started, I have deliberately avoided international news channels and local news channels. What I do is at a particular time of the day, not in the morning, not in the afternoon, towards evening time, I catch up on the news. I mute the volume control and I just read, usually these international stations, even local stations, they have this ticker tape that runs through the channels. I just read for a few minutes, not more than 5 minutes, and I'm out. I keep abreast of what is going on, but I don't feast on that because it is all negative news. Honestly speaking, I have not taken the metric because I've been avoiding TV in that way, but it's all negative news. So you can choose to ignore the sensational spins and save yourself unnecessary worries. Instead, Fill your time up by doing things that will bring a smile to your face and respite to your soul. So control what you consume is my fourth suggestion. The fifth suggestion, stay connected to your support network. Stay connected to your support network. By this I mean your family and your friends. You can even do this remotely if you are isolated, or if you are if you are isolated, you can do it remotely. We have the many apps on most phones. You have the WhatsApps of this world, the Telegrams of this world. You can do a FaceTime if you have the facility, or you can go on Zoom. A lot of meetings, if you notice, a lot of meetings are being held on Zoom. It's a very good way to stay connected to your support network. It will be better if you just pick up your phone and call somebody so that you can hear another voice at the other end of the line. That helps the feeling of well-being. That helps you know that, okay, you are still connected to your support network. Call people up. We can do the WhatsApping and the Telegramming thing, but for me, it's better, isn't it, if you just call and, how are you doing, talk to people and all that. So number 6 suggestion, and I'd like for us to please pay special attention to this particular suggestion. Structure your day. Structure your day. This takes the edge over the feeling in lockdown that every day is every day. You really can't tell, is today a Monday, is it a Wednesday, is it a Saturday, because it's the same day all over again. But I have discovered that if you structure your day, if you establish a routine, if you develop a pattern, then that pattern, that routine helps the boredom of lockdown. You need to stick to it for the most part. That is the way it will work. Establish the pattern. For me, for example, if you don't mind me using my example, I wake up in the morning, I do my personal devotion in bed, I get out of bed, and I exercise for a minimum of 1 hour. I do outdoor running, I do walking, and I do core exercises for 1 hour. After that, I have my bath, I prepare for the day as it were, and I sit down in my study to do my personal meditation. After that, I get out, I take breakfast if I'm eating in the morning with my wife on the balcony where there is a lot of air. We have time to gist and catch up. The last time we saw was when we got up from bed. We have time to gist. Thereafter, I retire to my study, I work. I do some office work because clients still expect you to service their business, which is legitimate, and we are grateful for it. I do my personal readings, and I also have my PS4 game in the study. So when I tire of that, I play some game, I go out, I crack joke with the children, I mix and interact again, and I go back to the study, or I go to get a siesta, although that is few and far between. And the day goes on. We have meals together, we crack jokes together. Then there is a window in the day. We just sit down, my spouse and I, we watch a movie or we watch series. So you're also doing family time, I missed out something. In the morning, we do family altar, and in the evening, we do another family altar. So all this is a routine and a pattern that gets us going. So I suggest to you, my friends, that you structure your day. Catch up with family and friends in between by phone calls, telegramming, WhatsApping. If you stick to it, you'll see that the routine becomes less burdensome. Now, the 7th suggestion, avoid speculation. Avoid speculation. Focus on facts. I'm sorry to say this, but a lot of speculation, conspiracy theories, and blatant falsehood, if you permit me to say so, blatant falsehood have invaded the social media space. It is unfortunate, but it is the truth. So, avoid speculation by relying on accredited sources of information on this disease. If you rely on websites like the World Health Organization, WHO website, the World Economic Forum website has a part of the website solely dedicated to information on this disease, there you will get credible, unsensationalized information, and this will bring you peace of mind. So please avoid speculation. Now, finally, my last suggestion to you is reach out for help. If after trying all I have earlier suggested, you still feel overwhelmed, then it is time to call in the Calvary. Now, let me say here that there is absolutely nothing to be ashamed of if you require help to discuss your mental well-being. Do not let anybody rob you of the benefit of talking to a counselor. Never. In more civilized, well, I don't want to use the word civilized, in more advanced countries, it is a given that you will consult with a therapist. People say it without thinking that you are a bad or a lost soul. It is only in Africa, because of the opprobrium attached to it, that people are jittery to seek help. There is an adage in Yoruba language that says, if you allow your bottom to become bad, it is your lot. So my friends, please reach out if you still feel overwhelmed after trying so many things, even much more than I have suggested today. Reach out. Seek a support group that can lend an ear and provide counsel. If you wish, you can also reach out to us with the contacts that you will see on the screen shortly. Do not bear this alone. You really cannot. Trust me, you really cannot bear it alone. But I have an assurance. This too shall pass. Let me reiterate finally that there is no shame in reaching out for help. There is absolutely no shame in reaching out for help. Why? The well-being of your family and your dependents may as well be at stake otherwise. So please reach out. If you find this video helpful, please hit the like button and please subscribe to this channel. If you subscribe to our channel, beside it you'll see a little bell. If you click on that bell, it means every time we release another video, you would be one of the first to get it. We love you. You are a destiny waiting to happen. Until the next time I come your way, I remain Adewale Adeniji. Stay safe and take good care of yourself. Bye-bye.